Hello, everyone.
Hello.
Thank you very much for joining today's session. We are going to discuss FGS and how to create awareness. We hope that a lot of us have started something about the challenge. But before we start, my name is Ruth Alote and I work in Ghana. I'm a subject matter expert and I'm here with my colleagues, Judith. And I'll ask Judith to introduce herself whilst we wait to start. Thank you. Judith, kindly introduce yourself. Hello, Judith. Hello, Judith.
Hello. Yes.
Yeah, okay. Judith, please kindly tell us a little about what you've done in FGS.
All right. Hello. So I'm Edith Chabika, a nurse in Ghana.
Hello. I think Judith is having some kind of challenge. Hello. Hello.
Hi. Hello.
Okay.
Yes.
Yeah.
So like I started, I'm Edith Chabika, a nurse. I work in the clinical setting. I'm a nurse. I work in the clinical setting, and currently I just graduated as a palliative care nurse from the Ghana College of Nurses and Midwives.
Okay.
So with FGS, I haven't done so much, though I've created awareness with my colleagues and some other patients. But like, because I was in school, I just graduated yesterday, so I'll be going back to the world, wishing to do a lot in the space of FGS. So currently, I haven't done so much, but yes. So when we met, I'm with one other colleague who is health information officer. So we intended to do a kind of research in our facility, which we are yet to begin when I resume work. So I'll be resuming work soon, and we are hoping on embarking on a research at our facility level, so that we'll see how to tackle FGS at our district level. So far, that's how I've reached with FGS in my facility.
Thank you very much. We also have Sidonia on the panel. Sido, please kindly tell us something small about what you've done before we start the session. Thank you.
Okay, so my name is Sidonia Adebuga. I'm also a subject matter expert and a nurse. I work in one of the rural districts in Ghana, Upper East region. So I was the only person who came from my region for the training. And then when I went back, I also tried to create awareness, but it was face-to-face. Anytime we have workshops, then I take the opportunity to take them through the slides Then we had some questionnaires that we administered just to get previous knowledge on people's perception about FGS. And then after the session, we try to evaluate whether learning has taken place. And then I've also even been able to get someone to work on the thesis when it comes to that regard. I think the last I was sharing with Ruth that that's what we're able to do. And then hers was to create awareness among, get the knowledge of nurses in specific on when it comes to FGS. So that data is still being analyzed. It's not yet complete for us to get the results of it. But then day in, day out, when I get the opportunity, I use it to create awareness on FGS. And through that, we were able to get 2 suspected cases, and we treated them. We administered the praziquantel, and then they were okay. Yeah. So for now, that's what we're doing. We're still creating awareness among nurses. And then this time around, we are trying to go beyond only the nurses and the midwives and bring the other health professionals on board. Yeah, thank you. Hello.
Thank you very much. Sidonia, can you please share with us some of the action slides that the action plans that you did? Did you have some slides to share, or you still want to go on talking to us?
No, for now, I don't have any action apart from the one we did earlier when we met in Accra. Yes. So is those action there, is those way forward actions that I used.
Can you walk us through what we did in Accra? So this session is actually to help people to create awareness on their own. Kindly share your story with us so that we can.
What we did in Accra?
Yes, your.
Okay, then you start. Let me look for it. Hello? Ruth? Hello?
Hello, Edith, please, are you there?
Yes, please.
Okay. So kindly share with us how tactically the steps you went through when you were creating your awareness, the little that you did, the steps while Sidonia gets on board.
Yes, so with when I attended the workshop while in school. So most of my colleagues that I reached out to, I just asked the person whether you know something, have you heard about FGS before? And they'll be asking, what is FGS? Because we know of FGM. Is there something called FGS? So that's like how you start going about it. So but just recently, I went to my facility and I had the opportunity of joining a meeting in the hospital. So in that meeting, like I had the opportunity of exposing my colleagues to FGS. So there I took them through the slides, just that the people were not enough. And I've been given the opportunity to come into their morning meetings, but because I'm not around, and my facility network is not so good. So if I want to do Zoom meetings with them, it wouldn't work. So face-to-face will be the best option for me now. So if I go back, I'll be able to do the face-to-face. But we were not given the opportunity because the slots were full for other topics. So we couldn't do, but asking them about whether they know something about FGS and realizing that almost everybody didn't know. I think I just had one person who is health disease control officer who knew something about FGS because he's into disease control. So he even went ahead to tell me praziquantel is the drug they give. But my colleague nurses, medical assistants, nobody knew anything about FGS. So from there, I shared the documents with them. Then with that, people got to know that there's something called FGS. My laboratory, I've also involved some people from my laboratory in it. So but I just hope that when I go back, I'll be able to do better than what I've done, because I'm away from the facility. It's quite challenging. But as it is now, I'm done with school, so I'll be resuming work. So I should do more when I get back to the hospital. But like I said, after asking and they don't know, they are able to tell them the symptoms so that we don't confuse it with other sicknesses or other diseases, because that's what we have always done. So when the person presents with difficulty in urinating or pain in urination, we link it with something else. So as I've now told people that there's something else called FGS, so they should now probe, or we'll start probing further. Instead of ending with UTI, we can now, they've been exposed to the fact that you can probe a step further. It's not only UTI that presents with so and so signs and symptoms.
Thank you
can
so
allow
much.
Screen sharing if she's done, so that I can share my screen.
Okay. Thank you so much. So taking off from where my colleagues stopped, you all heard from them that most people did not know what FGS was about. And that is why we are here today. We all want to get on board to end this menace. We want to create awareness on female genital schistosomiasis. And this session will also help us all to find out various ways of identifying female genital schistosomiasis, how to refer someone, how to even identify it, how to manage it, how to diagnose it, even though we still have COVID around. FGS falls under one of the neglected tropical diseases that we all know. There are lots of them, but today's session, we are focusing mainly on the female genital schistosomiasis. It affects women and girls globally. And as it stands now, over 50,000 women are affected with female genital schistosomiasis. Now, let us all look at the screen. Let's say wherever you are, you came across a 19-year-old female in a rural village who swims as a hobby. And you know, in the village, we all have certain chores that we have to complete, and we go to the streams to fetch water. She comes and says, I'm having genital itching or burning sensation in my genital area, or bloody urine, lower abdominal pain. What are we all likely to consider that is wrong with this young lady? Kindly put your answers in the chat box for us. So 19-year-old, a female, she comes with genital itching, burning sensation, bloody urine, and lower abdominal pain. Please, we have a minute. What do you think that this young lady is likely to have? I'm sure a lot of us have joined one or two of these sessions, but it's time for you to look at this question again. What do you think is wrong? Please kindly put your answers in the chat box. Okay, so UTI, we have different answers. I'm sure Nala said FGS, and then another person said UTI. So most likely, most of us would have gone for UTI, STI, any other thing. But for some of us who have been privileged to get to know about what FGS is, these are some of the symptoms that when someone is infected with female genital schistosomiasis is likely to present. what is the relevance of getting this knowledge about FGS? Actually, for me, I was just shocked to hear that over 450 million people are actually at risk of female genital schistosomiasis. And approximately over 56 million women and girls are suffering from this condition. It has a lot of impacts on us, economic impact, social impact, health impacts. Now, economically, can you think of someone who just has to do fishing activity, sell fish, or go for fishing, or just go to swim, and then the person gets infected with this infection? Socially, there's this stigma that is associated with someone who gets FGS. So because you'll be bleeding, because you have pain, because you have problems associated with your genital area, people actually shun away from you, and then you are stigmatized. They don't even want to get close to you. The health impacts. Imagine almost all of us here today that we are aware of FGS don't know about FGS, and we have people coming to our facilities. They come in because we misdiagnose and say it's STI, we give any treatment and then the person goes. Actually, these are some of the impacts that someone infected with FGS can have. And this has effect on the whole community, country, and global populations as well. It is so relevant that these statistics are shocking. That's, yes, you've heard about schistosomiasis, but why these huge numbers affecting women? And for all you know, you are not going to commit any crime. You are not, it's just your daily activity. And then you end up having such an infection. And over 56 million people have fallen prey to this infection. Now, FGS is caused by several species of schistosomiasis. So we have different schistosomiasis species, but the one that is causing FGS is the hematobium species. How does it occur? Usually, you need to have stepped into an infected water source that is infected with the female genital schistosomiasis. So when you step in the water and then it gets penetrating through your skin, it will travel through some organs and then get through your system, and then you start exhibiting symptoms. Now, how does it even occur at all? So we have snails in the water that usually covers the larvae. And then when the snails releases this larvae into the water and steps in, then you are likely to be infected with FGS. It's actually shocking. A lot of people who saw the link were asking, so is this in Ghana? But I'll tell you that every region in Ghana has recorded a case in female genital schistosomiasis. It is widespread in rural Africa and even in urban areas, because most of us, we travel from rural areas to urban areas. And there are urban areas that have streams, they have rivers, and some of this harbors the female genital schistosomiasis. Now, it is transmitted through the skin, as I said earlier. So not until you step into an infected water source, there is no way you are going to get this. Representations, as you saw in the scenario, you usually have females and girls coming down with illnesses, showing symptoms of bloody urine, genital itching, burning sensation, vaginal itching, bloody discharge, bleeding after intercourse or sometimes spotting, pelvic pain during or after intercourse. Actually, all these signs looks like STI symptoms, but you know, not until you know about it and then you do the right tests to find out, you will never know. So just as someone said in the chat, UTI, STI mimics the symptoms of female genital schistosomiasis. Now, how is it diagnosed? Usually you need to have a colposcopy done, but you can have a presumptive diagnosis just by the person telling you where he has been, the history as to whether he has entered into a water source. That should give you a clue. And then the signs and symptoms that the person is showing is also enough for you to arrive at a diagnosis of FGS. However, within the hospital facility, we do a colposcopy where we find rubbery tubercles on the cervix, and then we also have grainy sandy patches. The diagnosis actually has been very challenging because of the misdiagnosis that usually happens, also because lack of awareness among healthcare workers. The symptoms that is mimicking other disease conditions such as STIs, and then the lifelong complications. So usually some people assume that it's normal. Everybody that swims in this particular river has these signs and symptoms, and so you don't have to worry about. So this kind of things makes it very difficult for us to diagnose FGS. Now, what are some of the complications? We have a lot of complications arising when someone is infected with FGS. Apart from the stigma that usually goes along with it, there's infertility. Someone can be infertile, and it's not really due to any other cause, but because the person is infected with female genital schistosomiasis. There are people who have lived with it because they didn't get cured. So they are still infertile or might have even crossed the reproductive age. Some also come down with pelvic inflammatory diseases because they didn't know that these signs and symptoms could mimic female genital schistosomiasis. And to add to it all, with the healthcare facilities that you have to even go for care, you go there with any of these complications, and because no one is aware, you still go on and live with it. So before we go on to the challenge, I would like to show some resources that we all can use. We have the WHO Pocket Atlas on FGS, and then we can also find resources from online sources, the WHO websites, the Geneva Learning Foundation sites, and others. Now, thank you very much. And those of us who were not here the last time, today's session is actually more like a recap. We wanted to know whether some of us have started doing something on awareness creation. And we started the session with the panelists telling us about what they've done so that it can encourage us to how far we have come. So at this juncture, we want to open the floor for any of us, if you are here and you started to do something about the challenge, creating awareness. Please, the floor is open. Thank you.
So I would also like to add that you see that in the chat box, we had someone also stating the cancer.
Okay.
So yeah, at times those with the cervical cancer, it could also be misdiagnosed. The FGS could also be misdiagnosed as the CEO of the service. So now we have even introduced it as part of our screening processes. Okay. If we are screening for the CEO of the service, then we as well screen you for the FGS to rule out every possible cause. So those who are with us and then are part of the screening processes of the CEO of the service, they can also add it as part of their screening processes for FGS.
Okay, thank you very much. We'll ask Judith, please, do you have something to say before we take the questions?
This week we can go to the question session and see how it goes.
Okay, all right. Thank you very much. So as my other colleague said, sometimes within the hospital facilities, we've seen people who have been infected with FGS and have lived with this condition for a long time, presenting later to us as bladder cancers. So they come in having cancers of the bladder, cancers of the cervix, cancers of the genital areas. And as you can all see, it is quite difficult if you don't know about the condition. So as healthcare workers, we are encouraged that as we get this knowledge, let us move on to create awareness. Let's not keep it to ourselves. Let's try and tell other people about FGS. Thank you very much. Please, if you have any question, if you are surprised by anything, please put your questions in the chat box and you can raise up your hand and we'll call you to hear you as well. Thank you. Okay, Sidonia, please kindly check the chat box and then we'll be taking the questions for us. Thank you.
Yes.
Okay, so I think the person wants to know the differential diagnosis.
Okay, so I think in the presentation, we mentioned the conditions that you might
Mimic.
Yes.
FGS. So that's the differential. So sexually transmitted infections or diseases. So we might mistaken FGS for a sexually transmitted disease or a urinary tract infection. So these are some of the differential diagnoses: sexually transmitted diseases, then urinary tract infections. They are some of the diseases that mimic FGS.
And the cancer of the cervix.
Yes.
Okay, so in the lab, okay, please go ahead.
No, you can go on.
Okay, so in the lab, we do a urine sample to diagnose. You see, when you have blood in urine, that should also alert you that you need to do something more about this. Usually when it's seen and it's diagnosed, there's one treatment, praziquantel, and that will take away the FGS. In Ghana, it's actually a program drug, and you don't really have to pay anything for it. In areas where they are endemic, they do a multi-drug treatment, and it's run within the country. I'm not sure about other countries. Please, are you here? And maybe you are not from Ghana, you are from another region, and you can speak out to let us all know what happens in your country so other people can learn. Thank you. Hello, Sidonia. Okay, so now that we don't have any question in the chat box, kindly walk us through how you created awareness. It was so interesting hearing what you did. Tell us step by step what to do to encourage other people to also get on board this challenge. Thank you.
All right, so I'm sharing my screen.
Okay. Stop.
Okay. Has it been shared?
Yes, please.
Okay, so these were my specific action plans to enable me to be able to at least create awareness to some extent. So I immediately met with my district director and the team. So it was part of my plans to meet with the district director and give the briefing of whatever I came to learn here, and then whatever we were learning throughout. When we started the program for the first session, I used to communicate and let them know what was happening. When we did the impact accelerator, I printed the certificate, took it to the office, then they were all happy. So when we came for the SME training and the subject matter expert training, I went back with that certificate to inform her. And then I even asked if they could grant me audience at the regional level so that anywhere.
Hello, Sidonia.
Yes, please.
Please, someone says they can't hear you.
They can't hear me.
Yes, please.
Wow. Are you sure it's not the person's network?
Kindly raise up your voice a little. Thank you.
Okay. So when I went back with the certificates and to show my director, and then I told her that I was now an expert when it comes to the me in that campaign to be able to get others on board. I hope I'm audible enough now.
Yes, you are.
Okay. So we did that with the health promotion officer, the disease control officer, and then the public health nurse, because usually we do the public health activities with all these people together. So the next step was supposed to be with the medical superintendent of the hospital, and then to be able to get the clinicians. So that was where I had a bit of a challenge, because it's not easy to get all the clinicians at once. You know how the hospital setting is. So it was the hospital management and a few of the clinicians that I was able to meet. And then I had the nurse manager. I took him through and shared the slides with him so that anytime they have the clinical sessions, meeting sessions, and I'm not around, then he also used the opportunity to let the clinicians know that we have NGS, which is with us, and most people usually misdiagnose it. And then subsequently, I tried to incorporate it into my adolescent health activities. You know, most of the adolescents from our setting, the rural setting, when they close and they see the ponds, they will go into the water to swim. And that is where we have the schistosomiasis itself usually exhibiting. So we incorporated it into our adolescent health club meetings. Anytime we have the meetings with them, they will try to create awareness that we have this happening with us. So even we had an adolescent who came, it was a male adolescent who came with the schistosomiasis. So then I made the community health nurses to make a follow-up to that area, and then we organized and screened all the children that were around there, especially the females, to be sure that once one person comes with a case, it means that there are many others who are there, who are probably have not been diagnosed. So we did that too, and then God being so good, we did not get any case from them. And then I was able to also get the, please, am I audible?
Yes.
Yes, please.
So I was also able to have a meeting with the sub-district, you know, and the district level, we run the system at sub-district level and then the chips. So I was able to get the signer. Each sub-district will have a sub-district leader who is usually the physician assistant. I was able to meet them to take them through the slides that we used to teach us and shared the slides with them, and even gave some of them the handbooks that were given us. So that when they go back at the consulting rooms, in the consulting rooms and at their facilities, anytime they have meetings, they are able to meet them and discuss with them. So then after that, what I did was that anytime we have a meeting at the district where we have people coming from the various facilities, then I will ask permission from the district director. Either before we start the program, I will take them through, or when we finish the program, I'll take them through. So I had to seek for help from our supervisors, the UHAS, and then they shared with me some questionnaires that I could use. And that was what I was using for the pre-test and then the post-test, so that at least you'll be able to know whether learning took place. And with that, we are creating some sort of awareness among the nurses. And then after that, anytime I had the opportunity of going for my district trainings with the adolescent health, because I usually go to other districts to facilitate. Anytime we go to a different district to do facilitation on adolescent health, then I use the opportunity to do that. And then I was able to also recently, we did the polio vaccination. So when we were meeting the volunteers who were going to use on the field, I made them to understand that we have something called FGS amongst us, and it usually affects the females. So once they enter the houses or they get to the communities, they should spread the message that any girl who is having these symptoms, they should let the person come to the facility level, and then we can help them out. So that's how I have been doing it. And then I've been able to go, apart from not being able to meet all the clinicians in the hospital, I have been able to go through all my work plan. Then the PTAs, I've not been able to meet the PTAs, and then the MDAs, that's the assembly. So, and it's because at times of our work schedule, that's why I'm not able to. So I'm still on. I'm still doing that. And as Judith was saying, at times our network system in the rural setting makes it difficult for you to organize a Zoom session. If you want to organize a Zoom session, you will not get everybody to come on board, because some people, where they are, there's no even network. They wouldn't even see that you have sent them a message. So that is what makes it a bit difficult for us. But I was thinking the last time Ruth brought this thing on board, I was like, it's a good initiative. Maybe we can do it to help those around town. We can get the Zoom session to always get them on board. And then as and when we get opportunity to move to the rural facilities, then we'll take them one-on-one. So that's what I have been doing when it comes to FGS. And I think, as Ruth stated in the presentation, we have a lot of people out there who are suffering from FGS. It's just that they do not know that there's FGS. And most of our nurses and clinicians are not even aware. Someone asked me, what is that? A colleague, what is that? FGS? Then they will call me Schistosomiasis, madam. So it's really interesting to be part of you. It's interesting. I'm happy to be part of you.
Thank you very much, Sidonia. As we are taking off from where Sidonia left, one of our colleagues asked the differential diagnosis, and we explained that usually because FGS mimics other infections, they are actually misdiagnosed. And some of the differentials that actually come with FGS include UTIs, include other sexually transmitted infections, even sometimes gastroenteritis, you know, because when you have lower abdominal pain, somebody might think that it's actually within the stomach itself, the gastric region, and will not even think of female genital schistosomiasis. So we have quite a number of them that usually mimics FGS and therefore leads to misdiagnosis. Actually, now what we are recommending is how we can integrate FGS systems into already existing systems. So if you are working with WASH, that is water and sanitation programs, or you are the reproductive health area, how can we integrate FGS into the already established systems? Okay, so now that we are here, let us consider the challenge again. The challenge is for us all to develop a plan to raise awareness on FGS through an existing program or platform or service within your community. And you have to think about how you can describe FGS-related issue in your own country. So wherever you are joining us from, think about it. Where are you likely to find FGS cases? So if you're a staff and you are working in a facility, so where are you likely to find female genital schistosomiasis cases? And you have to remember, before you even start to create awareness and you are within a healthcare setting, it's important to engage the healthcare workers first so that they can also help you in your awareness creation. If you don't engage them and people get into the hospital and they are likely to be infected and others do not know about it, it will become a challenge. We are also to discuss the impact of FGS on either our nursing services or our midwifery practice. We are to also outline ways in which experience that you've had, the knowledge that you've gained, all the things that you've heard about FGS, how can you help you to effect a change in the current state that we are? So describe your solutions and the ways that your solution will help improve the situation we have now, and then globally, how can you send your messages across? So this is what we have to do about the challenge. And if it's your first time, we've been able to walk everyone through exactly what you need to create awareness. Initially, you have to start by planning. What do you have to plan about? You have to be strategic, and this will depend on where you are. What are some of the factors that you need to consider? You have to consider yourself. What are the personal factors that are likely to affect your awareness creation? And you also have to be innovative in whatever idea you want to bring across. Think about existing interventions and how you can really integrate FGS whilst you are planning towards this challenge. You have to put together all the knowledge and resources that you have gained so that it will be exciting to get your awareness creation on board. Now, after you finish planning, think about the problem. What is the problem that you really want to address? So for all of us here, it's about FGS, female genital schistosomiasis, and a lot of women and girls are being affected. What are the associated health issues that will lead to the misdiagnosis that we've already tackled? And you also have to consider the fact that there's good news, there's treatment. Therefore, factor this treatment, that's the use of praziquantel in your awareness creation. And if you look at the number of people who have been affected with FGS, over 56 million globally, that alone is enough to tell you that this challenge is crucial. Awareness creation is something that we don't have to wait. It has to start now. And we thank the Nursing Now Challenge for helping us bring this awareness creation to this level. We are also grateful to Caroline. Even though today she's not here, we are likely to meet her again our next session on the 28th. Now, you need to consider your communication strategies. Where you are, what are the communication strategies that work for you? So if you are within a hospital facility and the way they send messages across to you are through online means, then you have to think of actually creating this awareness through that means so that you can reach out to a lot more people. If you are within the facility and you think that the media, mass media will work for you, the radio stations will work for you, public address system or print media, you have to think about it and then you choose. Others have used other means such as using drama to portray and create awareness on FGS. Some have used music, and whichever one that works for you, you are encouraged to take it. Now that we are in an era where social media plays a lot of role in awareness creation, let's not forget whichever choice that you decide to use. Remember to share it on your social media links also so that it can reach far. Now, after you've been able to get this to this level, you need to think about the target audience, the idea that you want to bring across. Who are your target audience? Who are the people you want to really educate? Is it the people who are infected by FGS? Is it the people you work with in the facility? So you think about the type of target audience you want to create awareness within. And this will also guide you and equip you with how to go about it. Now, before you implement your awareness design, think about how feasible it is for you to create the awareness. Set deadlines and have plans so that you know which one will work for you, and then how much time you need to put into it. Now, you actually need to pre-test whatever you want to have so that you see that on the day that you want to have your awareness created, you won't have challenges. So we thank Sidonia, we thank Edith for what they shared, but at this point, I would want to pause so that if there are any questions, we can all answer before we leave. I think we have about 10 minutes for us to. Thank you very much.
Please, I would like to ask a question.
Please go ahead.
My name is Sakina. I wasn't with the group initially when it began, so I don't know whether it was mentioned.
Okay.
I would like to find out, is it transmissible through sex?
No,
like, can you? Oh, okay.
No, please. So STI, the only way you can get it is when you get into contact with infected water source. And that is the way the transmission gets into the human. So you can't transfer this onto another person through any means, except the person also goes to wade in the same water with you, steps in the same water with you, and then the infection gets transmitted. Thank you very much, Sakina. Any other question, please? You're welcome. Is there any other question? Okay, so at this juncture, we want to find out, are there people here who are having challenges with awareness creation that we started? Is there a way we can explain something more for you to get it? We are all here to contribute towards this challenge. Kindly put your message in the chat box if you're unable to speak to us. Okay, thank you very much. So someone is saying, please, are there posters available? Yes, so the last slide I shared has some resources that you can get. It's actually something that we are all working towards. So you can find posters, you can find materials, you can have the pocket atlas at the WHO site where you see pictures of FGS. You also find a lot of online materials about works that people have done. And you find posters as well. So kindly get on board. and you'll be well equipped to become an FGS ambassador. Thank you very much, Rosemary. Any other question? Okay, so we have about less than 10 minutes now. I want us to wrap up. So Sidonia, if you can summarize something small for us all to get on board this challenge. And then when you are done, Judith will follow in 2 minutes. Thank you very much.
Ruth, please come again.
Okay, so I was saying that we have few minutes for us to end today's session. So if you can give like a conclusion message.
Okay, so what I have to say is that for FGS, it's really with us. It's just that we are unaware of it, and then we keep misdiagnosing it. So what we have to do is try to create awareness as much as we can to let everybody know about FGS. I think that is the only way forward we have to let people know that we have FGS with us. And then when people come with those signs and symptoms, they will not be misdiagnosed, and then they can get prompt and adequate treatment. That's what I have. Thank you very much.
Thank you very much. So Judith, kindly send us some few words for us to try to wrap up. Thank you.
Okay, so FGS is not in town, it's in the villages. So if we are sitting at home, we will not be able to diagnose and treat those who need it. So we need to move into the communities, engage the people that needs to be engaged. Those who are our stakeholders are our clients. So when we spread the message to our colleagues, move into the communities, and we engage the volunteers, the health volunteers, we'll be able to pick up. Those volunteers actually know about FGS because they know about schizo, even if it's not for the female genital, they know about bilharzia. So when you go into the communities and explain this to the community members, the health, those volunteers, you'll be able to pick up information. They can get these informations to us so that we'll be able to get those people the right treatment and avoid the complications that we have mentioned, stigma, infertility. And most times, I think those in the facilities, there are some people with infertility, we are just treating them. For all we know, it can be FGS. So let's probe further so that we'll be able to get people the needed help so that we can get them off this stigma that is so huge and having an impact in their lives. Thank you very much.
Thank you very much. So I'm so grateful to all of you. We are about wrapping up. So today's session was a recap of earlier sessions that we've done. We are so grateful to the Nursing Now Challenge group. We are grateful to Caroline, who will be with us on our next session on the 28th. Please kindly save the date on your calendar so you can be here with us, so that together we can all try to end this menace. At least a take-home message should be FGS, that is female genital schistosomiasis, is something that exists. It is with us. Over 50,000 million people are infected with it. And a lot more people are suffering and living with this condition. That's a way we can all contribute. Whatever we've heard about the way it's transmitted, the way the symptoms present, and the treatments, let's not forget, praziquantel. It's available. And in most countries, it is free because it's a program drug. But how can we know and refer these cases when we don't have knowledge about it? So this makes it very crucial for us all to get on board. Thank you very much, and we hope to see you again in our next session. Thank you all. Bye.
Thank you very much.